So hi everyone, we are going to learn about otosclerosis. So the word you can see two portions. Sclerosis means hardening of the ear. So this picture I am drawing is the middle ear. Here you can see the tympanic membrane, then the malleus, ingus and the stapes. Now here the oval window and the inner ear is extending from here. So this is the cochlea and you can see the semicircular canals. So this is the middle ear, inner ear. So first we are discussing about the etiology and pathogenesis. Here you can see there is a hardening in the foot plate of stapes. There is an abnormal bone formation. So what happens? There will be no conduction. Whatever sound is transmitted, it will not be transmitted to the inner ear because due to this abnormal growth, stapes is immobile. So it prevents the transmission of this sound or the vibration. So that is conduction is having problem, conductive hearing loss. So it can be affecting both the ears. Now the cause for this can be some disease like a measles, any viral infection, or any genes. Now we will study what are the types. Two types, histological and clinical. Histological means no clinical symptom. In clinical there will be clinical presentation, which can be again divided into three: stapedial, cochlear, mixed. In stapedial otosclerosis, the problem is in the stapes. What we have shown in this picture is that stapes is having problem plus ankylosis in the membranous labyrinth. Ankylosis, so this is the bony labyrinth. We know this is the bony labyrinth. In the middle you have the membranous labyrinth. So in the first case there will be involvement of the stapes as the name say, plus ankylosis in the membranous labyrinth. In the cochlear, the otosclerosis is actually encroaching or involving the membranous labyrinth. In mixed, both are getting involved. So in stapedial, the hearing loss is conductive hearing loss. Here it is sensory hearing loss. Here it is mixed, means both. Mixed hearing loss. Now we will study about the clinical features. So we told hearing loss. Since the inner ear is involved, there can be vertigo, tinnitus, dizziness, like that. There can be pain, earache and headache. So for the diagnosis, the history is important. Physical examination is important. In case if there is any fluid, you can do tympanocentesis. You aspirate the fluid and you send for culture. You can do CT, MRI. CT is to know if there is any collection of fluid in the ear or in the mastoid region. Now to evaluation of the tumor and soft tissue, you can do an MRI and you can go for the audiometry test, tuning fork test, like that, because there is hearing loss. Now how to manage is the next question. So the management can be medical, surgical, we know. Management can be medical and surgical. So Since there is pain, we told there is earache, headache, so you can give analgesic like ibuprofen, acetaminophen. That means paracetamol can be given. Hearing loss, so that you can give hearing aid. But in surgical management, you can actually remove that abnormal bone, that is stapedectomy. This can be partial or complete. Partial means you can remove only that abnormal bone growth. In complete stapedectomy, you remove the entire stapes and fix a prosthesis. Or you do stepidotomy. Stepidotomy means you are drilling a hole using micro drill. Apart from that, you should do some general measures also. You avoid going to a noisy environment. You have more protein diet, all these things. So these are very important. So this is about this management, medical management and surgical management. This is the short description of otosclerosis. Thank you.